Hi, I'm Dr. Carolyn Alexander at Southern California Reproductive Center, and I get asked a lot, what is endometriosis? And endometriosis is a really interesting issue. It's where the menstrual flow grows where it shouldn't grow, and that can affect the fallopian tubes, the uterus, as well as the ovaries. And in some women, it can cause cysts on the ovaries called endometriomas, and that can impact ovulation and egg quality. The most common clue that we get about endometriosis is really bad cramps or pain with intercourse. And some people, when I ask them, have you ever missed school or work for your cramps or your menstrual periods? And they say, yes, it's happened to me, or they've had dramatic effects during their periods. That can be a sign of endometriosis. The other thing about endometriosis, which is kind of challenging, is that some people don't have any signs of it. When we do an ultrasound to look at the ovaries and the uterus, lo and behold, we see cystic areas that look like endometriomas, as well as the uterus can sometimes look like enlarged, called adenomyosis, which is endometriosis in the actual muscle of the uterus. And that can impact the embryo's ability to stick and grow, and so that can affect fertility. Endometriosis is possibly genetic. A lot of people say their sister or cousin or their mom or their grandma had really bad periods, and that can run in the family. It can also be environmental factors such as endocrine disruptors in plastics, in a lot of chemicals that we don't 100% understand, and that can disrupt the hormonal environment and cause endometriosis as well. Endometriosis can impact fertility in 5 different ways. Number 1, it can impact egg quality in some situations. Number 2, it can affect our fallopian tubes, the catcher's mitt of the egg, and it can affect the ability of the fallopian tube to undulate to allow the egg and sperm to connect. It can also impact the uterus. As I mentioned, adenomyosis can be endometriosis in the muscle, and that can impact the embryo's ability to stick. It can sometimes affect our ovarian reserve or our egg supply in some situations. And so it's important to get a checkup with your OBGYN or your primary care doctor to ask for a blood test called AMH, anti-Müllerian hormone level. And that number, really, we're hoping for it to be above 1.5. And so if it's above that number, then you're in a good position. If it goes below, there's still always hope and there's always a good egg, but we have to jump in and help as soon as we can, because time's not on our side when AMH starts to go down. And the last thing that endometriosis can do is cause inflammation in the peritoneum, which is the fluid around your bowels. And that's why some people feel bloating, really bad gassy, crampy pain with their periods. It can have cytokines in that fluid that are embryotoxic, that can hurt the embryo. And so I encourage women who think they might have endometriosis to think about a gluten-free diet. We talk about vitamins such as CoQ10, vitamin E, talking about yoga, exercise, and green tea, decaf green tea, and thinking about little things they do. So too much alcohol over the week is not ideal in situations where we have endometriosis, and everything in moderation. So I try to not go too hard on patients, but it's important to think about what you're doing over your week and try to think about minimizing exposure to toxins. And we're here at SCRC, happy to help. All our team is so wonderful and caring and ready to help you if you think you might have endometriosis or want to get a checkup on that.